My name is April Ella, Director of Operations and Project Manager of the Opioid Overdose Prevention and Response Training Program and naloxone distribution by A New Path, in partnership with the San Diego County Sheriff's Department. A New Path, Parents for Addiction Treatment and Healing, is a nonprofit organization working to reduce the stigma associated with addictive illness through education and compassionate support, and to advocate for therapeutic rather than punitive drug policies. The Ask Mom How to Save a Life project is part of A New Path's national Moms United to End the War on Drugs campaign. A New Path testified in California in 2014 to pass the Naloxone Access Bill to allow organizations like ours to provide naloxone training and distribution under the standing order of a licensed physician. During this training, you will learn about opioids, how to recognize and respond to an opioid overdose, how to use naloxone or Narcan nasal spray. What are opioids? Heroin, morphine, codeine, oxycodone, prescription painkillers like Vicodin or Percocet, fentanyl, and carfentanil, which are synthetic analogs of opioids. Naloxone only works for opioid overdose reversal. It does not work for any other drugs. What is an opioid overdose? The brain has many receptors for opioids. An overdose occurs when too much of any opioid, like heroin or OxyContin, fits in too many receptors, slowing then stopping the breathing. What is naloxone? Naloxone is a prescription medication that reverses an opioid overdose. It cannot be used to get high, it is non-addictive, it is safe and effective. Doctors and paramedics have used it for decades. Naloxone also goes by the brand name Narcan. It is an opioid antagonist. How does naloxone reverse an opioid overdose? Naloxone has a stronger affinity to the opioid receptors than the opioids like heroin or OxyContin. It knocks the opioids off the receptors for a short period of time. This allows the person to breathe again and reverses the overdose. What to expect? Overdose can be instantaneous or over a period of time. They happen as a process. Someone could slowly stop breathing. They usually happen 1 to 3 hours after the drug was used if a person is actively using. With fentanyl or carfentanil, it can happen instantaneously because fentanyl and carfentanil are so much stronger than other opioids. With new users, it can be instantaneous if they have never had opioids in their system before. Risks for overdose. Mixing drugs. Benzos are common in opioid ODs. Uppers and downers do not cancel each other out. Mixing opioids and stimulants actually increase the risk for overdose. Tolerance changes like illness, leaving jail, or detox, using alone, change in dealer, product type, or purity, change in method of taking from sniffing to injection or vice versa, and thinking you know everything. Signs and symptoms of an opioid overdose. Body is limp, face is pale or clammy skin, and they could be passed out. Breathing is slow, irregular, or has stopped. Heartbeat is slow, erratic, or not there at all. Blue or ashy skin usually shows in lips and fingertips first. Small pupils, or they could be awake but unable to respond. Choking sounds, gurgling, or throwing up, or have thrown up. Identifying an overdose. So you've seen enough to be worried. Now you check on them by tapping their foot, asking them if they're all right or okay, maybe saying something alarming. If there's no response to any of those, please try the sternum rub. Take the tops of your knuckles and rake them across the breastbone hard. This is enough pain to wake them up if any pain is going to wake them up. If there is still no response, call 911 and continue with rescue procedure. Responding to an opioid overdose in 6 steps. Step 1, call 911. Let them know where you are and that someone has stopped breathing. Step 2, continue on to rescue breathing. Put the person down flat on their back, tilt the head back, plug the nose, and take 3 big breaths into the person. Step 3, administer naloxone. Step 4, administer second dose if no response to the first dose. Step 5, continue rescue breathing if your supply of naloxone is depleted. Step 6, stay with the person, monitor their breathing, and wait till emergency medical services arrives. Deploying your nasal kit. Peel back the package to remove the device. Place the tip of the nozzle in either nostril until your fingers touch the bottom of the patient's nose. Do not press the plunger until you are ready to administer the dose. Press the plunger firmly to release the dose into the patient's nose. Remember to keep these 6 steps in mind in responding to an opioid overdose. In 2014, the California 911 Good Samaritan law was passed so that you and the person you are rescuing are free from arrest or incarceration, because in good faith you are saving someone's life. Responding to recovery position. If you have to leave or leave the person alone, please put them in recovery position. On their side, place the bottom arm under the head, place the top leg crossed over the body. Knees should be bent for stability. Responding when they come to. Let this person know what's happening. Explain that they've overdosed, you've administered naloxone, and that they may be in withdrawal from the naloxone dose. Stay with them and monitor their breathing, and inform them that naloxone could wear off in 30 to 90 minutes and that the opioid is still in the body. They can overdose again if they use again too soon. If paramedics are not coming, person should visit a doctor as soon as possible. They could have fluid or vomit in their lungs or have fallen and hit their head and gotten a concussion. They should seek medical attention. What happens if I use my naloxone? If it gets used, contact a new path. There is no punishment, and you can get a new dose of naloxone, and additional doses are available. Please contact a new path at 619-670-1184.